Welcome to a very special episode of Epic Understanding. Today, we are going to talk about speech pathology with Taranya Boykins. Welcome, Taranya.
Hello, Coach Love. How are you today?
I am fantastic. Can you please tell us what is speech pathology?
Well, since speech pathology has evolved so much over many several years, I'm going to give you the definition straight from our governing board. It's from the American Speech Language and Hearing Association.
Mhm.
So I'm going to read this so that I get it right.
Okay, great.
Okay. Uh, we work to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. And I'll say that when I say children through adults, we're
Mhm.
talking about from infants all the way through adults to the end of life.
Oh,
There's sometimes a role for speech pathologists in those areas.
that's very interesting. Now, can you tell us how you got into speech pathology?
Well, I funny story. I started college as a vocal performance major. I was a singer.
Mhm.
And I got my first year of college and realized that I have to take algebra and history and science, and figured that if I still have to take all those hard classes, I'm going to make sure that I'm getting a degree that's going to get me paid. And I went to in doing my research, I went to volunteer at a hospital in the rehab area in the speech pathology department. Shout out to Baptist Hospital of Miami. They
Mhm.
let me volunteer there and do a lot of their clerical work. And in return, I was able to sit with them through a lot of their sessions. And I mean, these ladies threw me to the wolves. I remember one of my first sessions, there was a little boy that went under a table, and the therapist got under the table with him, and I sat there and thought, am I ready to do do all that? And then there was another session where the therapist wanted to show me more of the medical side, and she went to the room where a man had a trach sticking out of his neck. And she told me to stand back because she didn't know whether I'd be able to take what I was about to see. And she was holding her hand out like this, and he coughed, and there was some interesting things that happened, and I saw all that and said, I can handle it. I'm game. I'm ready. So I went into the next part of my education, knowing what I was getting into just from experiencing all of that. And I went ahead and got in that way.
So, what I'm hearing is speech pathology is both medical and educational. Is that right?
Yes, and I wouldn't mind going ahead and telling you each area if you don't mind.
That'd be great.
Let me walk you through what speech pathology entails.
Okay.
So when most people think of speech path, they think of sound errors, that child that has a lisp, or maybe they are unable to say the R sound correctly, so they're saying wabbit instead of rabbit. That's common, and that's what most people think of when they think of speech, and that's articulation or speech therapy. Then there is language therapy, which involves two areas: receptive language, that is auditory comprehension or reading comprehension, so how we understand language, and then expressive communication, which is how well we express ourselves in speech and in writing. There's also fluency, and that's stuttering. That's also a common area that most people think of when they think of speech pathology. Voice therapy, that is referring to the quality of your voice. So how your voice actually sounds. Is it raspy? Is it harsh or hoarse? Is it too low? Is it too high? That's voice therapy. Um, then
Wow.
we also have, I'm
Tanya,
sorry.
I just have to pause you there because you've given us so much. And honestly, I think I'm going to have to invite you back so that you can break down each of those areas for us.
Okay.
That's so very fascinating and interesting. And
Mhm.
I can see how each one of those areas could require a lot of therapy and focus in order to correct
Right.
the person's illness or area of focus.
Mhm.
Now, before we go too far down the line, I want to know about the two areas that we plan to talk about today, and that is stuttering and stroke victims. Can you tell me, how do you help those guys?
Okay. Well, with stuttering, that involves a speech assessment,
Uh-huh.
and not sure what that sound is, but that it involves receiving a speech assessment, and the therapist is able to look at someone's speech fluency to see how well they're able to speak and communicate, and they're able to analyze their speech to see what exactly is happening. So that's a very specialized area. With like I was going through each of those areas. It's so broad in everything that we do. Um, I honestly have gotten through my career. I'm talking about 17 plus years,
Wow.
and have not treated a lot of fluency clients. But so it's not my specialty area, but it is very common.
Mhm.
And yes,
So someone could go into speech therapy and never work with a stroke victim or never work with a person with fluency issues. You can really be specialized. Is that right?
definitely. It's almost hard to be a jack of all trades in speech pathology. You have some therapists that come out of college and go straight into the schools, and then
Mhm.
they wouldn't know anything about trach care. And then you have therapists that go straight into the hospital and work with swallowing all day, and they know nothing about writing an individualized education plan for a student in the school.
Mhm.
So there's so many different areas. Now,
Mhm.
you also asked about working with stroke victims
Yes.
or people that have had strokes.
Uh-huh.
They have a wide range of, they could possibly have a wide range of disorders as well. One of the main areas, believe it or not, is swallowing. I mean, when I worked in a rehab center, it was so prevalent that I could have 10 people on my caseload, and
Wow.
6 or 7 of those would be swallowing.
Mm.
And so that is one of the areas that we do specialize in. And um, a lot of times, people that have had strokes, do have difficulty with swallowing. They
Mhm.
also have difficulty with their speech. So most people think of strokes and they say, "Oh, their person's speech is slurred." That's called
Mm.
dysarthria, which is a speech disorder.
Now say
Then
that
there's
again. What is that called?
dysarthria.
Dysarthria?
Yes, it's a fancy way of saying slurred speech.
Okay. Okay.
Then there's another disorder that's pretty common with people that have had stroke. It's called aphasia. This is a loss of people's ability to either comprehend or express language. I explain to my patients quite often that sometimes their vocabulary is trapped in their head, and when they have that stroke, they've lost the ability to access that vocabulary. You know, they're smart, it's just that they are unable to access their vocabulary or put words together or find that word they're trying to say, like they have a word on the tip of their tongue.
Uh-huh.
That's called aphasia.
Okay.
And one more area I want to speak on is named apraxia, another speech disorder
Uh-huh.
that affects the muscles in the mouth.
Okay.
It affects their ability to sequence themselves.
Okay.
So sometimes the words come out jumbled.
Wow. And so what you're telling me is even though someone has these problems, they can actually be improved with therapy.
Yes.
Wow.
Usually so, yes. So sometimes, every stroke is different,
Mm-hmm.
and some people recover fairly quickly.
Mm-hmm.
And then you may have someone that takes years to recover. or they may require uh, compensatory ways of expressing themselves
Mm-hmm.
through use of speech generating devices.
Mm-hmm.
You've seen the machines that talk for people,
Yes.
those type of devices. Some people require those. So
That
it's a wide range.
that's fascinating. Let's talk a little bit about the career of speech pathology.
Okay. We can be work in several settings. Uh, there are a lot of speech pathologists in schools. There's still a shortage of speech pathologists, but every public school has a speech pathologist assigned to them, believe it or not.
I really
Elementary
do.
through high school. I'm sorry?
So, so let's hang around that particular area. There is
Okay,
a shortage of speech pathologists, and
definitely.
so what does the career path, or no, let's start. What does the education path look like for a speech pathologist?
Okay. We are required to have a master's degree.
Mm-hmm.
And after we receive that master degree, we also have to take a test. It's kind of like our bar exam. It's called the
Okay.
praxis. Sometime during our educational uh, time, we have to have that praxis done, and then we have 9 months of supervision after that master's degree, where
Mm-hmm.
we have a job, but we still require that supervision from someone that has their certificate of clinical competence, and that's where we're going. We're trying to get to where we can have those C's.
Ah,
Those C's are so important. They look like nothing to everybody else, but we earn those C's. They're so important to us. So that is our certificate of clinical competence. So let me review that. It takes a master's degree, passing the praxis exam, and having 9 months of supervision. And within our schooling, we've had a lot of clinical hours that when we have to see people from all age ranges during that clinical time. So we experience a little bit of everything.
so let me ask you this. For someone who's just starting school right now and they're wondering about what path they should go down, is it worth it?
Yes, I believe so. It is a degree that you can't get in it for the money. And I'm not saying that it's something that doesn't pay well.
Hmm.
It usually does pay well,
Okay.
but you have to be a people person. You have to want to work with people and be that cheerleader. You
Hmm.
have to have that personality. And like I said, we're still in demand in every arena. So whether you want to work in a school, you want to work in a rehab facility, a hospital, there is most likely a job waiting for you.
Oh, that's excellent. So,
Somewhere somebody's going, what? But I'm telling you, there is a job waiting for you.
so this is
In
a
demand.
in-demand field.
Mhm. Yes, it is. And I think that part of that is that people don't know it's speech therapists most people call us speech therapists. They don't even know the term speech pathologist. So they don't even know what we do. And that's a problem.
Hmm.
And people don't even know to get in the field. If they go into rehab, it's usually physical therapy.
Hmm.
And I think occupational therapists, we work alongside all of them. I think even occupational therapists feel our pain. Nobody knows what they do either.
Hmm.
Uh, but we all usually work together in some way.
That is fantastic. So, I'm going to ask you a money question now,
Oh,
but it's a safe one.
I
And
may not answer.
now, please do give us a range. If I was just graduating from college, what range do you think I could make? You know, where could I be financially? Because
Coach
that's
Love, you're trying to get me in trouble, but
no,
okay.
just a range, just a
Okay.
range.
Okay, I will tell you that some therapists are in the school system, and it depends on the school system. They're paid as teachers.
Okay.
Usually, I mean, when I last worked in the schools, we were teachers, but we also had a stipend. So there
Oh.
was money, added to that. So I will start by saying that they can be paid as a. I'm a speech pathologist. I am. I really am.
Yeah.
But they can have a teacher salary,
Uh-huh.
or they can have on the upper range. They can go into the lower six figures, $100,000
Mm-hmm.
range, and those may be those researchers and professors.
Mm-hmm. So essentially, you can write your own ticket, so
You
to speak.
can. You
That's
can.
very interesting. That's very interesting. Would you say this would be a good job for a parent?
Definitely. I
Mm-hmm.
think so. There is a lot of flexibility. As I've stated, we worked in so many different areas in different settings. So you, as a parent, I think you would just need to find that setting that works for you. When I had younger children, I tried to work in this, well, yeah, I still have younger children, but I tried to work in this school system where I was able to be more with their schedule. So when they were out of school, I was able to be with them. And as they got older, I was able to branch out and go more into rehab, and where I could work that 8 hour day solid. And now I kind of work a hybrid where I'm doing some home health, and then we have the private practice, telehealth and home health as well. So there's a lot of different settings that we can work in that might fit that parenting need.
The reason why I asked that question is because more and more people are looking for job opportunities that give them a work-life balance. And sometimes when you are in the medical field, there is no work-life balance. But I'm not hearing that from you. It seems as if you can really enjoy helping people in a big way while having a work-life balance.
I'm not going to I'm not going to pretend that everything's perfect. You have the opportunity to have a great work-life balance depending on where you end up working. But speech pathology is difficult. I, for example, I work in home health, and a lot of times I bring those evaluations home. I still have notes to complete, and they have a timeline on those. So it doesn't matter whether my kids have baseball practice, I need to get that done by a certain time. So work life balance, there's an art to that, and you need to find the setting that's right for you.
Okay, fair enough. Now, we have a watcher, and they said from Facebook, hi, Facebook. They said, people think speech therapists focus on talking, but they also help with thought organization. Is that correct?
Definitely. Well, I think I listed one of the areas being cognitive communication.
Hmm.
That is an area that there's a lot. Let me back up. I told you that when I worked in rehab, I could have 10 people on a caseload, and six or seven of those would be swallowing. It also goes that six or seven of those would be cognitive communication. There's a high need for that. And people have difficulty with thought organization sometimes after strokes,
Uh-huh.
or maybe they've had a head injury, or they have dementia, or other progressive diseases that cause cognition to fail. So they need someone to come in and help with that. And they've sometimes lost the ability to think of the words that they're trying to say, or to
Uh,
put words together. Or they thought, like they said, thought organization, just planning and problem solving and memory. Memory, how could I leave out memory? We do a lot of things with memory strategies and so on.
that
And
is
that's
very interesting. Now, before the show, you and I were talking about a few myths regarding stuttering. What are a few myths regarding stuttering and how it comes about?
Okay. Stuttering, one of the myths was that it's caused by trauma necessarily. And uh, it it's possible that stuttering can be brought on by trauma, but it's not necessarily the cause
Okay.
of it. And but it can exacerbate it. Then there's another one where some people believe that it's brought on by bad parenting, an overbearing parent. You know, you put too much pressure on that child. Uh,
Mm-hmm.
that's not something. That's not. We're not going to blame parents here.
Okay.
When the research is coming out that it could be the way that your brain is wired, it could be environmental, it could be genetics. So we're not going to, tell mom that having too many tutors and having you in too many extracurricular sports and too much pressure is causing
Oh,
the problem.
wow.
You
Mm-hmm.
know, then that the child is anxious.
Okay.
Some people are steady hands. They're fine. It has nothing to do with anxiety. That's not necessarily the cause of stuttering either.
Mm-hmm.
So there's a lot of myths out there that, or here's one. I know I've seen some celebrities say that, it's almost like they could yell at them and force them to speak right. I'm just going to talk to you and tell you you need to take a deep breath and talk straight. You can't coach somebody into talking right, that way. There, once again, there's an art to that. Then it's not as black and white as some people seem to think it is.
Wow. Um, Stacy said, what about anxiety issues? Can that cause stuttering?
I think that where we are as speech pathologists is that we believe that anxiety and the likes may exacerbate the issue, but it's not necessarily the cause of it. So
Okay.
maybe your therapy would include I was talking about breathing techniques, but maybe that's part of your therapy,
Mm-hmm. Mm-hmm.
depending on what works for you and what the therapist has
Mm-hmm.
come up with.
Should there be any shame associated with stuttering or other speech issues?
Absolutely not. Absolutely not. It's not something that you caused, number one. And number two, the purpose of speech therapy or speech pathology is to get you communicating. In the end, are you communicating? Did the person that you're talking to understand what you said? Did they understand what you meant? And this is our purpose, to make sure that you are understood and you're able to communicate effectively. Get your thoughts, ideas, wants, and needs out, expressed.
So, oftentimes, after someone has a stroke and they have a speech issue, the family does not get therapy immediately because, you know, there's a lot going on. If you if you wait and there's a gap, is it too late to start therapy?
No, it's not. I know when I was in school, the rule of thumb was the first 3 months is where you see the fastest rehabability,
Mm-hmm.
and then 6 months, and then a year, and then
Mm-hmm.
after 3 years, not so much. But times have changed, and research shows that you can always, almost always, continue to improve. But it is important, I feel, that you do receive your therapy as soon as possible after the actual incident, so that you can get going. And your brain does do some spontaneous healing itself.
Mm-hmm. Mm-hmm.
And the therapist's job is to guide that and to come up with strategies and work with what you still have, uh, so we can get your speech going, enhance your communication.
Wow. So, is it ever too late to improve your speech?
I don't believe so. Some people are seeing improvement several years after having a stroke. They're starting therapy all over again, and they're starting to see that they are able to make some gains.
That's
Yes.
exciting.
Mhm.
Is it hard? Is speech therapy hard for the patient?
For the patient, I would say, and it depends. Yes, usually. Now with children, it depends on what disorder they do have. And sometimes children are not aware, which is
Uh-huh.
sometimes a blessing. They're not aware of this disorder, and it feels like they're in therapy with you, and it feels like they're playing. And sometimes we are playing because children learn language, and they learn through play. But
Mm-hmm.
if you're an adult and you did have that stroke or head injury, and you're worried about your livelihood, or you're worried about being able to take care of your family, or just in general being able to get back to where you were talking again,
Mm-hmm.
then that is cause for concern. So it's difficult when you go to say something that should be fairly natural and easy, and it just won't come out. That's very frustrating, of course. So it
Wow.
can be difficult for the patient. And I will say therapists are human too. It can be taxing on our emotions as well. That's why you can't, when I said you can't get it in it for the money, and you have to be a people person, when that, wife comes up to you and says, Taranya, I'm really worried, and I need to know that everything's going to be okay. What are you going to say? Oh, I'm sorry, my 60 minutes are up. I got to go. I'll talk to you about it. What are you going to say? You have to be that person that speech therapists are natural counselors. You have to be going to counseling mode and let that person know that you're trying your best, they're trying their best, and we're going to have to wait it out. Or maybe it's also a mother that's concerned about their child that's being bullied, or you have to be a natural counselor for that.
Wow. So do they train you for that while you're in school?
Well, I didn't know they were, but I know I took 8 different psychology classes. Psychology ended up being my minor, and it's not because I wanted it to. It was just that I looked at my transcript, and they said, you can claim psychology as a minor. I said, let's do it. So
All
yeah, 8 courses. So I suppose they did train us to be counselors.
All right. So, in all actuality, if you go to school for speech pathology, you will be prepared for what's coming your way.
Definitely.
That's amazing. So, do you have any final words for our audience?
Well, I want to say that our governing board of the American Speech Language and Hearing Association, they usually ask us to make sure that we're being seen, or that we're recruiting, because like I mentioned before, there is a shortage. And definitely, I just want to make a plug that for people of color, if there's a career that you're interested in, come and look at speech pathology. We need you. And as in any industry or any profession that does not have a lot of diversity, I, they may miss out. We're talking about speech here, where we're making up assessments and analyzing speech and language. So we need people from all walks of life, in all ethnicities to come out and give this profession a try. We need you.
That is an excellent point. It is well known that people receive care from people who reflect their community. Thank you for that.
Thank
Oh,
you.
you have been spending time with Taranya Boykins on the Epic Understanding show. Taranya, please tell us where they can find you.
I am at Virtually Speaking, and you can find us online at virtuallyspeakingslp.com. And we have telepractice, so we can see you online. And locally here in Lakeland, Florida, we can come to your homes.
Excellent. Thank you so much, family, for watching. I'll have her back again so she can share more. Bye bye for now.
Bye. Thank you.